This video was originally designed to be used in our clinic during an office visit. You may simply watch the video for general education, or if you plan to use this in preparation for an upcoming wellness exam, you may print out the handouts and checklists mentioned in the presentation. These are found in the patient education section on the website homepage. This video was produced on behalf of your healthcare providers at the Center for Family and Preventive Medicine, Dr. Henderson, Dr. Roach, and nurse practitioner Patricia Henderson. Among the most valuable healthcare benefits available to you are those that prevent or lessen the harm of serious disease. One of our most important roles as your healthcare providers is to help you understand and take full advantage of these benefits. Thanks to advances in medical science, a number of serious and potentially life-threatening diseases can be prevented or at least diagnosed at an early stage. This can make the difference between a long and healthy life and a life that is needlessly shortened or burdened with disability. A simple test or procedure can often prevent a lengthy and costly hospitalization. In the case of cancer, preventive services may eliminate or reduce the need for chemotherapy, radiation, or surgery. An added benefit is to lessen the financial burden you may have with a serious illness. As your primary healthcare providers, we strongly recommend you take advantage of the best healthcare available today by putting preventive medicine at the top of your healthcare priorities. The remainder of this video will present information on the major preventive services that we encourage you to consider. These are tailored to your age and gender. This information will be updated at least annually to ensure it is correct for your age and based on the best scientific information available. Therefore, we shall ask you to review this periodically in conjunction with one of your office visits. The topics covered today will be cancer screening, the influenza or flu vaccine, and screening for depression and tobacco use. We will also touch on the important subject of advance directives. Your medical assistant will have provided you with a handout that will give you important information on preventive matters not covered in this video. This will include immunizations not provided in this clinic, injury prevention, nutrition, exercise, substance abuse, safe sex, dental health, skin health, and CPR training. Colon cancer screening typically begins at age 50 unless you have a mother, father, brother, or sister with colon cancer, or you have a family history of one of the highly malignant types of colon cancer such as familial polyposis. Prostate cancer screening typically begins at age 50 unless you have a father or brother with prostate cancer or you are of African American descent. Vaccinations are among the most underutilized of adult preventive services, and this deficiency is the cause of an estimated 60,000 preventable deaths in the United States each year. Today we shall discuss the influenza or flu vaccine. There are many myths or misconceptions about this vaccine. The following information is based on the best scientific information available. The first myth is that influenza is not a dangerous disease, and the truth is influenza causes 36,000 deaths per year in the United States, mostly in the elderly and persons with chronic disease, and it also causes 200,000 hospitalizations. Another myth is the flu vaccine causes the flu. The truth is this vaccine cannot cause the flu. This is perhaps the most common reason this vaccine is not taken. Remember, it does not cause the flu. If you got a flu-like illness in the past after taking the flu vaccine, it was most likely a bad coincidence and not caused by the flu vaccine. Please do not let this misconception keep you from getting a vaccine that can literally save your life. The next myth is the flu vaccine is dangerous. The truth is the flu vaccine is very safe except for persons allergic to eggs or having a history of a serious true allergic reaction. Signs of a true allergic reaction are lip swelling, breathing difficulties, or a choking sensation. The final myth is that the flu vaccine is not effective. The truth is the influenza vaccine is very effective, with up to 70% reduction in hospitalizations and up to 85% reduction in death from influenza. The bottom line on vaccinations is get your flu vaccine, unless there is a real medical reason not to do so, and this is actually very uncommon. You should also review the adult immunization schedule given in your handouts today and be sure to get all the recommended adult vaccines as indicated in that handout. Depression is a very common mental health condition that causes a great deal of human suffering in terms of decreased quality of life. In its most severe form, it can be fatal as the result of suicide. Depression can be easily detected through a simple questionnaire, and the available treatment is safe and effective. Tobacco use is the leading single cause of preventable premature death and disability by causing lung disease, heart disease, and cancer. There are very effective treatments now available that can help motivated smokers to quit permanently. A final area we wish to present deals with the important issue of advance directives. These are legal documents. You use them to leave instructions for your wishes regarding your health care in the event you are unable to do so. There are two major forms of advance directives, the health care proxy and the living will. The health care proxy is a document that names the person who can carry out your health care decisions if you are unable to communicate them. You should obviously select this person carefully and make your wishes clear in advance. The living will is a document that declares your health care wishes to be carried out in the event of a terminal illness or a condition where you are unable to communicate. These are two resources for you to obtain advance directive information, and you will receive a copy of this today in your handout. You should always consider having an attorney check over these documents. This brings us to the end of this presentation. Your medical assistant will have given you a simple checklist and questionnaire corresponding to the preventive services covered in this video. You will have the choices of 1. Giving us your consent to provide or schedule the recommended service. 2. Letting us know you've had the service so we can update your chart. 3. Declining the service, or asking for more information before making your decision. If your answers regarding depression or tobacco use indicate the need, we shall provide you with additional educational material. This is an example of the checklist you should have. All that is required is your placing a check mark in the box of your choice for each category. In this first example, an X is placed in the box that indicates you have a mother, father, brother, or sister with colon cancer. The next example shows a different choice by placing an X in the box that indicates you have a father or brother with prostate cancer. If you have vision or reading disabilities, your medical assistant will help you. We shall review this information with you and act on the recommendations and information in accordance with your choices. We hope that this video will have answered most of the common questions that arise and will allow you to make the most informed decision possible on these vitally important health services.